Hello. In this video lecture, we're going to be covering coding diseases of the ear and mastoid process. And again, these are coding diseases of the ear and mastoid process. These cover codes H60 through H95. These codes include all diseases of the external ear, internal ear, middle ear, if you will, mastoid, the inner ear, any other disorders of the ear, and all intraoperative and post-procedural complications of the ear that are not elsewhere classified. And again, another odd thing, there are no chapter-specific guidelines, so we need to cover the general coding guidelines as they pertain to coding diseases of the ear and mastoid process. And again, as you'd expect, there are a lot of instructional notes. These include things like use an external cause code. There are a series of exclude two conditions that are listed that are applicable to all conditions that are coded in this chapter. There are many other notes in the tabulate that remind the coder to code first associated conditions and to use additional codes as indicated. There are instructional notes with certain categories that we want to make sure that we do. For instance, picking up exposure to tobacco smoke, tobacco dependence, and tobacco use. As you'd expect, this chapter contains specific codes for infections, inflammation, lesions, obstructions, hearing loss, and other conditions associated with the ear. Conditions of the external ear fall into code categories H60 through H62. These include things from the auricle, the external acoustic medius, which is the auditory canal or passage that leads to the eardrum. Otitis externa is an infection of the external auditory canal. We refer to it as swimmer's ear. And again, specific codes that will cover the laterality on this that fall into code categories H60. So we can either have right, left, bilateral, or unspecified. Some categories H62.4 and H62.8 require the reporting of an underlying disease that caused the ear condition. So you'll see a code for this underlying condition note in the tabular. Diseases in the middle ear and mastoid include codes that fall into code categories H65 through H75. You'll see in the tabular a lot of use additional codes for any associated perforated eardrum that's included with otitis media, codes that fall into the code category H65. You'll also see those use additional codes for exposure to smoke, personal use of tobacco, and other tobacco related codes. And again, otitis media, which is basically the inflammation of the middle ear, and these can be described as acute serious otitis media, acute non-suppurative otitis media, chronic non-suppurative otitis media, and others. Important thing to bear in mind is the laterality, where we have either right, left, bilateral, or unspecified ears. Similar to the eyes, we have two ears, so we have to get the fully correct code by specifying the laterality. And again, eustachian salpingitis and obstruction. These are these acute and chronic infections of the eustachian tube in the ear. And again, we see the eustachian tube inflammation, the eustachian tube salpingitis. Basically, we're talking about the same thing. We are not talking about inflammation of the female reproductive tract. With mastoiditis, we're looking at code category H70, and this could be described as acute, chronic, and again, the codes include, as you would expect, laterality, meaning left, right, bilateral, or unspecified. What mastoiditis is an inflammation of the mastoid bones, and it's usually an extension of a middle ear infection. With these codes that fall into code category H70, chronic mastoiditis occurs with a chronic suppurative otitis media. Again, mastoiditis and related conditions, these all fall into code category H70. And some of the common microorganisms include such things as Streptococcus, yes, influenza, group A strep, gram-negative bacteria, and Staphylococcus aureus. Sometimes we'll get a perforation or a rupture of the tympanic membrane or the eardrum. This could be the result of infection, inflammation, and in this case, we would code any associated otitis media first. And this would be codes falling from H65 through H67. A term that we see sometimes is autosclerosis. In other words, autosclerosis is the growth of spongy bone in the inner ear where it causes some sort of obstruction. You can also have Meniere's disease. Meniere's disease causes vertigo, ringing in the ears, dizziness, hearing loss, what have you, usually only affecting one ear. These codes fall into code category H 81.0 dash. And again, the dash is because we have two ears. It's either left, right, bilateral, or unspecified. Then we have vertigo, the H81.1, right? The dizzy, sometimes described as dizziness, a little bit different. And sometimes we can't find out exactly what it is with vertigo. So just have to work off the documentation that's provided to us. Now with H90 and H91, we get into hearing loss, can be conductive or non-conductive. Outside of the conductive, we can have sensorineural, the H90 through H91. And we can have this occurring in one ear with unrestricted hearing in the opposite ear. We can have other unilateral mixed conductive or sensorineural hearing loss. Again, the key here is to read the documentation to make sure we're capturing it exactly as it is. And then finally, last slide here, we can have our post-procedural complications as you'd expect. And again, the key is to read exactly what is documented. And that's all I have for you. Thank you so much for watching, and we'll see you online. Bye now.